I will make a short screen, okay, doctor?
So
Can
now,
you give me the...
yes, I'm just doing this. Just a minute. Now you can start. Nur.
Yes. Okay. Did I start, doctor, or waiting? Doctor, can I start?
Yes, start please.
Okay. Hi, today me and Diana and Aus will talk about Calgary-Cambridge method. We are in group number 5 in Al-Farabi University. What does the Calgary-Cambridge method mean? This method means that we'll know a strategy for teaching and training clinical communication skills. Kurtz and Silver published in 1996 as a way to define the communication curriculum and develop a practical teaching method. That means we will be effective and complete clinical communication skills are widely, and we need to make it for quality health care and to be positive impact on health outcome, including better communication, better treatment for all of them, and to lead more calm and complete the hospital care. Section of Calgary-Cambridge method: initiation the session, clothing the session, gathering information, and building relationship, and explanation and planning.
Okay, so firstly, we're going to start with the explaining and the planning broken down into the 4 subsections, which are the planning, which are the providing, aiding, and achievement. And each one of them we should talk about separately. So since the Calgary-Cambridge model is presented in 3 diagrams, but here we are presenting in 4 like kind of diagram, the aiding and providing and aiming. Noor, please put it on slide 14. Oh, sorry. Okay. So, and providing, it says meant by providing the correct amount and type of information, which is a very important point, such as the aims or provide extensive and suitable information to each patient without a restriction or overloading them, and chunks and chunks, and assesses patient starting point and asks patient what other information would be helpful, and of course give explanation at the appropriate time. Second of all, we have the aiding point. Aiding point, you should like aid an accurate recall and understanding. Of course, aims, and we can find the word aims and it's common between the 4 of them, which is so important. And make sure to that information are easier for the patient to remember and understand, because of course the language of the patients differs from the language of doctors and medical team, so they need to, the information needed to be easier understood, because to easy know their diagnostic. And we have the organized explanation and use explicit categorization or signal posting. There are 3 important things I would like to discuss, such as the uses of repetition and summarization and clarity, and uses visual methods if appropriate, and checks patient understanding of information given or plans made. So when we use visual methods, it's so important for the patient to recognize at that point, because visual methods are always suitable for like 70% of people around the world, and this is actually a truth, a scientific truth, because visual methods remind them of their diagnostic and etc.
And here we have the achieving a shared understanding, interrupting the patient's perspective. First, we have the aims, encourage dialogue and consideration of patient viewpoint, thoughts, and feeling. Relates explanation to the sickness framework of the patient. Provides chance for patient to contribute and encourage them to do so. Recognize both verbal and non-verbal cues. Patient views, response, and feeling are elected. 4. Planning. Planning shared decision making. We have aims, involve patient in decision making if they wish increase patient understanding and commitment. Shares own thoughts, ideas, dilemmas. Involve patient by making the suggestion rather than directives. Encourage patient to contribute their thoughts. Negates, offers choices. Checks with patient. And last, we have the closing the session, summarizing, contracting, safety netting, final checking. And that's it. Thank you.
Well, is it all? Okay, thank you for the presentation. Who would like to comment on this presentation, evaluate using the criteria we were speaking about, maybe your own criteria? So,
I need just say it's a
What's
good
your name?
explanation.
Your name?
Bilal.
Bilal, yes. So please, Bilal.
I just said it's a good explanation and good PPT.
You like it, yes?
Yes.
Okay, so Ramil, so what do you think?
I like the design and visualization of the presentation, and it's also informative. It's interesting to listen, watch.
Okay, so the overall impression is good, yeah? Okay, so I agree that the design is stylish, so the slides have different pictures, design, and it's not boring just to follow the speakers. Okay, so it's good that you give the reference to some scientific research, because so the Calgary Cambridge method is just the result of some scientific research, and it's good that you use diagrams, and you can just describe, not just read the text, and you also divided so the text into just chunks, like and marked them by the bullet points. It's just the visual perception of the text is good. So, and so the speakers just tell us the story, like not read from the screen. And yes, design is stylish, I've said. And as for example, if you meet a difficult word which you don't know, so you should just think whether the audience know this word, and maybe you can you should try to adapt the text if it is hard to read. Adapt the text to the audience. Just use some synonyms or change it. So there's something in the text. So you should work with the text. And of course, if you don't know how to read a word, you should consult. So the resources, you should search for the information about pronunciation of the word. Well, so you should do your homework, like prepare for the presentation. Well, anyway, so I just like it. So this presentation. So maybe I would recommend to add some more pictures, like, yes. But anyway, the design is okay. Well, this is my opinion. So thank you for your presentation, for your work. Mhm.
Thank you, doctor.
Thank you.
Well, and yes, we can continue with the, yes, with the, yes, with the slides here. And so as you see, yes, we will listen to the next group, Ramil Bilal and Abdelrahman. So next class, and now let us just focus on the following slide. So today we are going to speak about people involved in the work in general practice in hospitals. And so let us have a look at the pictures here. We can see 4 pictures, and so the job titles here on this slide. And so the question is, can you predict what each person's job involves? So in each picture, picture A. So Ars, what do you think of picture A?
I think it's the receptionist, maybe.
What are the receptionist's responsibilities?
I think they take the information, like the number of the name and
some personal information, right?
yes.
Okay, yes, and so she is also in charge of just finding the right piece of information from those patient history that we can see on the shelves, the background. Okay, so in picture B, Yana, can you comment on this picture, please?
Picture B.
What kind of job is it?
Sorry, I didn't hear you. Picture B. B, you mean the second picture?
The second picture, right? Yeah.
Yeah. So here, there's like a patient, and she's visiting like a doctor, and they are communicating. I guess it's like a health visitor, I guess.
Why do you think she's a health visitor?
Because she's old lady, and I think she needs like some kind of diagnostic for any kind of problem she has.
And what is the place? Where are they?
They're like they're not in a hospital, of course. It's more like a house. It's something like, yeah, it's like a room.
Okay. Yes, and she's visiting her patient. Yes, at home.
Yeah.
Okay, so thank you. And yes, Aisha, picture C is for you.
Yes, D. Can I talk about D?
Okay, D.
D, it's a midwife.
Mhm.
because it's support and care for women during the pregnancy and the labor and the birth, and help
Mm.
to stay healthy in pregnancy, and if no complications arise, to give the birth with a little inversion.
Mhm. Okay, yes, you're right. And the picture C, Yusuf, what do you think of this picture? Yusuf,
Which picture, doctor?
picture C, this one.
Yes, doctor. There is doctor and patient, and I guess the doctor he asking the patient about her diseases or something like this.
And so the job title of the doctor is given here. This is general practitioner, right? Mhm.
Right.
Okay, so and three more pictures. Picture E now is for Bilal. Bilal, hello. Is Bilal here? No. So Suat, please. Suat,
Yes, miss. Which picture?
picture E is for you. What kind of job is it, and what are her responsibilities in her job?
I think it's a practice manager.
So picture
Because
E or picture F? So it's yes. Actually,
because I think she's in a car. I'm not pretty sure. So I think she's probably the
mhm.
this
Okay.
practice.
Noor, please.
Okay, doctor. Number F is particle manager because he tell him the information what should them do, and how make an hospital, and he tell him the information.
Mhm, mhm.
And
So
number E.
he's also their person just who works for a hospital. Yes. Yes. What about
Yes.
E picture?
I think the distractor nurse because she in the car and going to home and another.
In her district, right? Mhm.
Yes.
Yes, actually, she works just outside the hospital, just visiting the people who need some extra help at their homes, just like injections, vaccination, all kind of things. Okay, and Ramil, what do you think of the last picture, G?
It's a practice nurse.
And her
And
responsibilities?
yes, she doesn't go to houses, but instead stays in the hospital and gives treatments in the clinic or in hospital.
Mhm. Okay.
Like here, checking the heartbeat, giving injections, and etc. Some kind of slight or smooth treatments.
Yes, she works with the general practitioner in the hospital normally. Okay.
Yes.
Mhm. Okay, and so the question, what do you think is the most stressful aspect of medical work? Aisha,
Yes, doctor.
yes, can you answer this question?
What do you think is the most stressful aspect of the medical work? To think about the patient and
Mhm.
and how
Okay.
can I say it? And their treatment.
Mhm. Yes, Nuru would like to add something, right?
Yes, don't sleep to go and give him the medicine, see her, pressure her what you need, and you should 12 hours see what the patient need, and every 1 hour go to the room and ask them if he okay or not.
Mhm. So this causes stress because of the pressure of responsibility for a patient, right?
Yes.
Mhm. Okay, so and if we speak about rewarding aspects, what is good? Why do people want to be doctors? What is the most rewarding aspect of medical work? So, yes, Ramil?
So teacher, in my opinion, the most rewarding thing is saving the people's lives and becoming the hero of the
Mhm. Yes.
like the meaning of our job. You know, it's the most rewarding when we manage to save their lives, to treat them. Doctors, I think we become happy, joyful.
Mhm. Yes. Okay. And well, Swat, would you like to add something?
Yes, I agree with Ramil. The most rewarding feeling is to know that you've saved someone's life, and also to help the patients who are suffering with really bad diseases to get better and give them a bit of closure as well for the family. So they know mentally what's going on inside of them, so they're not always stressing about it.
Okay. Mhm. Thank you. Well, and so here there is the practical just exercise, just how that will help us to remember the job titles. So those job titles which we have discussed: receptionist, health visitor, general practitioner, midwife, district nurse, practice manager, and practice nurse. So if we look at these sentences, the task is to add the job title of the people to the sentences. So for example, a practice is run by whom? So what is missing in the first sentence? What do you think? So this is like run by. Run has the meaning of just supervise some kind of process, to organize the process. So which word is missing? Which job title is missing here?
Maybe practice manager, teacher.
Exactly, this is practice manager.
Yeah.
You're right. Well, let us do like this. First, I would like you just to write the job titles, please. So you should choose from the list of the jobs on your paper. So write receptionist, health visitor, general practitioner, midwife, and so this group: district nurse, practice manager, and practice nurse. And so are you done? Now just I'll give you.
Number 2 is the midwife.
Okay, so I'll give you just a couple of minutes, like 2 minutes to 3 minutes to complete the sentences with these job titles. Start, please. Do it individually and then we'll check. Okay, Aisha is done. Mark has also done. Okay, let us just start. Aisha, will you read it? The next sentence, please.
Yes, doctor. The third, because the next Noor say it's birth wife. I forget the name.
Which job title is the number 2?
It's a midwife.
No, it isn't. So it's not a midwife. So
Nurse practice.
so works with the individuals. Okay, so who knows this? Yes, so what?
Is it the district nurse?
Like groups like elderly people, families, newborn babies in the community. Yes, I think the responsibilities of district nurse are very similar to doctors, to health visitors. Yes, for example, in my country, in Kazakhstan, there is no such different jobs. There is one health visitor who is the doctor, and just yes, there are some nurses, yes, also, yeah. Okay, but here this is the health visitor. Okay, and so Aisha, you just wanted to read the third sentence, yes?
Yes, doctor. Need very good interpersonal skills because they are the first connect people have with the practice. It's receptionist.
Receptionist, exactly, you are right. Okay, so Yana, please. Number 4.
97% of the UK population is registered as the practice nurse.
Look, they are registered with some doctor, some professional, yes?
So yeah.
So what do we call this kind of job? Well,
district nurse.
Ramil, number 4.
General practitioner.
Exactly, they are registered with the general practitioner. This is like therapist, for example, yes, in our country. Okay, well, so Afs, what do you think of sentence 5?
The duties of include traditional nursing skills and specialized units for immunization. I think it's maybe the health, no, maybe the practice nurse.
Okay, actually, this is the practice nurse because it involves just nursing skills. Yes, traditional nursing skills. Well, Yosif, what about sentence 6? Yosif?
Yes, doctor.
Number 6, please.
Um,
Read it.
okay. An important link between hospital and GPS and other health professionals involves in antenatal care is the general health.
Sorry, who? What did you say? Will you repeat, please?
It's general health. Number 6.
The key phrase here is antenatal care. What does it mean, antenatal care? This is the care of newborn babies and so pregnant women. So, and the job title here?
Maybe midwife or
midwife. Yes, you're right, midwife. This is midwife. Well, and Bilal, are you here? No, Bilal is absent. So what about sentence 7?
Okay. They visit those who are housebound and recently discharged from a hospital and dress the wound. I think it's a practice nurse.
So actually, practice nurse responsibilities are described in number 5. And
Health visitor.
And health visitor, his responsibilities are described in number 2. So we have this is district nurse. Yes, district nurses visit the people who are housebound, so who just can't move to the hospital. Yes, this is district nurse. Okay, and so, and there is information about this surgery. So a GP place of work is called a surgery or office. Surgery is also refers to the time the GP sees patients. This is in the United Kingdom. So, and so do doctors work outside hospitals in your country? Ramil, can you answer this question? Ramil? Hello? Are you with us?
There is 1 minute left.
I see. I see that we have less than 1 minute. Okay, it means we can pause and